Now, this table gives us a good overview of what general foods would have when it comes to total amount of fat versus saturated fat. You can see that most of the plant-based types of fats are going to provide a lot lower amounts of saturated fat, the one we're trying to limit, with the exception of coconut oil, where it obviously can add up very quickly. It really depends on that individual. If this is the only source of saturated fat that you have throughout the day, then that's not bad at all. But if you have a lot of these other ones that are high in saturated fat, well, maybe there's some adjustments that need to be made so that you stay with under that guidelines, especially if you already have cardiovascular disease or you're at high risk for it. So what's the hype and confusion when it comes to coconut oil? Well, it all stems back from studies looking at different populations who have very high intakes of coconut oil. For instance, the Polynesians, they have lots of coconut oil within their diet, yet they tend to have very low rates of cardiovascular disease. And so led a lot of association types of experiments and research to conclude that, well, coconut oil must be heart healthy. But upon better research, we find out that coconut oil is actually high in saturated fat. It once was thought that no, it's not saturated fat, it's really medium chain triglycerides, not the saturated fat, but a healthier version of it. But actually, it's a low percentage of that. And so these medium chain triglycerides, I will tell you, are very heart healthy. We'll often give them to patients within the hospital for different purposes. But coconut oil itself it acts more like a saturated fat within the body. It's high in more those long chain fatty acids, things like lauric acid, which have 12 carbons and digests more like other types of long chain fatty acids. So if we look at the largest body of research, what it says is that coconut oil significantly increases LDL. That's the unheart healthy form of cholesterol. It does not help to lower triglycerides, as you may see every once in a while. You'll see these types of reports when you do a Google search. It does not help to reduce body weight. It does not help to improve, or which really means to lower inflammation or glycemia, your blood sugar. So this originally was kind of what people thought of, but there's a lot of other things, remember, that tends to affect cardiovascular disease. So if we think about back to the Polynesians, well, what does their lifestyle look like? What does the rest of their diet look like? Well, I promise you, it does not look like that they have lots of coconut oil plus sedentary lifestyle plus fast food and additional amounts of other forms of saturated fat. No, if this is the only form of saturated fat that they are having, and they have a very active lifestyle, meaning they are probably growing and consuming their own foods, not going to you know McDonald's and getting their types of saturated fat, that's fine for them. And plus, they also have different genetics as well. But that's why we have to look at the whole picture here and not just what one type of an association or epidemiological study says. This table really helps to give you a good view. So remember, saturated fat, that's the one we're trying to keep very, very low. We have the monounsaturated omega-6s and omega-3s. We know that and this are all heart healthy. Not so heart healthy here. It was not pictured here as trans fats. We know that those should be kept to less than 1% of your calories, but at least we have a good view of these. So if we go down some of these most common forms of fats within our diet, we can see, if we're looking for the lowest amount of red, and we know, hey, seems to be something we need a lot more of, and we're not doing a good job of. Well, let's look at that. What has the lowest amount of saturated fat and yet the highest amount of omega-3s? Yes, the monos and omega-6s are still important. A great variety of these is really ideal. What do we see? We see flaxseed oil, that's one, not always the best when it comes to cooking, so not really feasible there. We got fish there, salmon, or I'm sorry, tuna, salmon, walnuts, great here. We have a good proportion of the omega-3s. We don't have a ton of foods here that provide us with omega-3s. And so if we look down here to canola oil, we have a very small amount of saturated fat, a great source of monos. We do have a good percentage of omega-6s, not really an issue anyways, but still have a good amount of omega-3s. And so canola oil, think of that as if you went to Walmart and you found vegetable oil. That's canola oil. It's a blend of different types of vegetables, giving you both plant sterols, plant stanols, and these omega-3 fatty acids, plus other ones, and a low percentage of this. So for me, when I am recommending different types of fats for cooking, canola is much more economically feasible when it comes to the greatest population of people. So I recommend this for the majority. And then, if you're more of a cooking person, you like to taste better, well, hey, olive oil is still pretty low in saturated fat when it comes to percentages here. Remember, this is in percentages, not grams. It's still going to give you great sources of monos and omega-6s, tiny bit of omega-3s, not great sources there. But this is it's also going to do a lot better when it comes to taste with food. So this is a great one, can be more expensive. This is really my fault too, is what I will recommend is canola oil. As long as you keep it away from heat and light, you're going to have great sources here to get some of those omega-3s and plant sterols. Of course, incorporating all of these other sources of omega-3s is ideal. Now, I clicked this slide a little bit too fast. If you were to go back and look at the previous slide, which this type of recording device does not allow me to do so, you would notice at the very bottom of that graph that coconut oil has the highest amount of saturated fat. So that's something that we have to do as, more scientists and healthcare providers, is to provide our consumers with more reliable information and let them know, hey, I know that you might see a lot of information about coconut oil being very heart healthy, but in fact it's really not. It acts more like a saturated fat. It has a considerable amount more of the saturated fats than other types of fats to use. Now, a few definitions to understand as we discuss more heart disease issues. Coronary heart disease, can abbreviate it as CHD. Encompasses a wide range of different types of issues when it comes to heart health. Most prevalent is the cardiovascular disease, or any type of a condition that's going to affect the coronary arteries that serve or provide oxygen and nutrients to the heart. Know that both for men and women, heart disease is the #1 killer of adults in the US, but I would also say worldwide. And it is impacted by nutrition. Does not mean that if you do all the things right for nutrition that you completely avoided it, but you could lower your risk. So if we really want to know those risk factors for heart disease, I want you to picture someone that you love that's an older adult. And I want you to think about these types of factors. What is their obesity like? Do they seem like they have an excessive amount of fat on their bodies, especially if they carry it in more of the abdomen range? What about diabetes? Do they have especially type 2 diabetes? What about high blood pressure? Are they already taking high blood pressure medications? Have they been known to have things like high cholesterol, high triglycerides? Now, another thing is, and I want you to pay good attention to, is the age and gender. Now, both men and women is the #1 killer, right? But men just tend to be affected about a decade earlier than women, and that is because of the protective factors of estrogen. So estrogen seems to protect us, but then, unfortunately, menopause hits, and now our risk factors after the age of 55 is exactly what it is for men. Genetics, if you tend to have a parent, grandparent that has a condition related to the heart, you're more likely to also have it. Plus, if you combine all of these things and then also have a lifestyle that includes things like tobacco, lack of exercise, and poor diet, then you're more likely to really increase your odds of having some type of heart disease issue. So if we look just at the diet, we have to factor in poor diet as being one of those. Well, what does poor diet look like? Factors that increase the risk: diets that are high in saturated fat, trans fat, sodium, high in, and I hate that this says this, but added sugar, excessive energy that you're not using because you're not active, or alcohol. That's going to be your increased risk factors. If we want to lower your risk factors because we know that you have a ton of these issues going on, then we want to change this diet to this diet and make sure that we have a diet that is higher in poly and monounsaturated fats, higher in fiber, higher in much of nutrients, especially B vitamins, antioxidants, and we either omit or at least lower alcohol intake into what's considered moderate intake levels. Now, I have been using the term cardiovascular disease throughout this presentation, and I want to just further define this into talking specifically about atherosclerosis. Now, atherosclerosis means hardening of the arteries, hardening of the arteries. And so here is a very healthy artery. You can see nothing's blocking blood and nutrients to pass through to deliver on these nutrients and oxygen to the tissues. But if we have any type of injury to the artery, we just need a little bit susceptibility in these enterocytes, like something like high blood pressure begins to create kind of a weakened artery wall, then that means that this LDL cholesterol that's passing to and from the liver to the tissues can get inside here. And think about that as like just, it's not the same, but just think about it as being like a bacteria. A bacteria gets inside your tissues, it's going to cause inflammation and pain, right? And a whole bunch of other issues. Same thing, we have LDL cholesterol, which can do some great things, but out of control, it begins to cause this inflammatory response. So oxidation is what this is called, and this triggers a whole line of issues. So anytime you have oxidation, that triggers these macrophage cells to come in and try to enact on what looks like a foreign object. And these end up turning in from macrophages into what's known as a foam cell. Foam cell kind of restarts this whole issue of your body seeing a foreign object and trying to attack it. And eventually these foam cells turn into a plaque. That plaque gets more and more of those cells, macrophages, cholesterol. It ends up, excuse me from the dogs, turning into a plaque. And the plaque can do two things. It can either get bigger and bigger and bigger and occlude this, meaning that it blocks this blood from getting through, or it could rupture, and this could cause a blood clot, and that blood clot can travel into areas we don't want it to. So here's an example of what the heart would be. We have it's either cut off here from blood supply, or we have a blood clot that has ruptured and gotten stuck somewhere. And now this tissue that needs oxygen and nutrients is no longer getting that, and it begins to die. And so we have a problem here that can lead to a heart attack or a stroke. It kind of gives you a better look at what this would be. So here's the blood that should be getting down to the rest of, nope, to the rest of these tissues here, and it's not getting there, and so this begins to die off. Most of the time when we think about plaque and arteries, we're thinking about the heart, but remember that these arteries are all throughout your body, including the brain. And so it's hypothesized that it's probably also affecting your risk of things like dementia and Alzheimer's, things that are different types of cerebrovascular types of conditions that affect your brain and memory. And so if we think about this kind of looking like that heart artery earlier, not being able to supply good blood flow, well, the same thing will happen if these plaques also that are carrying nutrients to your brain are clogged up. And so if we don't have good blood flow and oxygen, then that means that those tissues in your brain are not also getting those nutrients it needs in order to stay healthy and be able to transmit one type of signal from one neuron through the synapses into the next type of neuron. So gives you another thing to think about. A lot of people worry about their heart, but when I see people begin to think about their risk of things like Alzheimer's disease, which is a very scary disease, sometimes it's another way of getting their attention to this condition.